Hi, my name is Kimby. Welcome to Mom Talk Autism. What you have seen in the video just now is all true, but these are only few of the autism symptoms because autism is a spectrum disorder, which means one person with autism can be affected more than the others. Even with my twins boy, the autism affected them individual differently. Some professionals called it mildly, mediumly, severely affected, high functioning or low functioning support, require substantial support, require very substantial support. Now I hope this video will give you a clearer picture of what is autism. Firstly, autism is a neurodevelopmental disorder. This means that it's affected the development of the brain and it shows during early childhood. Because there's no physical features, parents might have missed out the difference in their child. Perhaps when they are age of 12 months old, they start to realize that the child do not show any joint attention. For example, the gesture of pointing. Perhaps the child does not show any single word by 16 months. And perhaps when the child does not respond to their own name. These are all red flags for the parents. If you see all these red flags, please seek for professional help and get diagnosis immediately with a trained, recognized professional, such as clinical psychologists, child psychologists, child pediatrician, and also psychiatrists. The autism diagnosis described in two broad categories. Category A, deficit in social communication and social interaction, while in category B are restricted, repetitive pattern of behavior, interest, or activities. Under category A, there are three deficits. A child needs to meet all three different symptoms of deficits. The first deficit is a deficit of social, emotional, and mutual responded. For example, whether your child be able to hold a back and forth conversation, initiating a conversation, or sustaining a conversation. Number two, deficit in non-verbal communication. Now you can see your child don't initiate the eye contact or no eye contact. Difficulty in body gesture such as pointing or other body language. Number three, deficit in relationship. Difficulty making friends or keeping a friendship. Under category B, which is restricted, repetitive behavior, interests, or activities. A child needs to meet at least two criteria above all four symptoms. Stereotype or repetitive motor movements, use of object or speech. Some of these examples like flapping hands, lining up toys, or keep repeating the same phrases. Secondly, insistence of sameness, inflexible or rigidity, such as eating the same food, wearing the same clothes, following the same route to school every day. Thirdly, highly restricted, fixated interest in a high intensity or obsession. For example, when the child is having an obsession with certain character like Barney, Thomas the Train, to whatever it is that fascinates the child. And fourthly, is anything sensorial, whether the child is hyper or hyperreactivity to the sensory input, which means the child might be oversensitive or undersensitive to the sensory stimulation, which can include either lights, noises, or even textures. The child needs to meet 2 out of 4 symptoms to attain a diagnosis for autism. Let me recap. Autism is a spectrum disorder. It is a neurodevelopmental disorder. There's no physical features. Symptoms can be present at early childhood. Accurate diagnosis need to meet the two wide categories. First, deficit in social communication and social interaction. And the second categories are restricted, repetitive behavior, interests, or activities. And there's no two individuals with autism share similar degree of difficulties. Now, that is what autism is. Thank you for watching Mom Talk Autism. Please remember to subscribe and click the little bell. See you again. Bye.